I'm Dr. Melanie Palm. I'm a dermatologist and cosmetic surgeon in Southern California and San Diego, California, and I am the director of Art of Skin MD.
So I'm actually here with my M22 device here at my own office, and I have several modules on this. I have the IPL module, the new ResurFX module, as well as the Q-Switch Nd:YAG. And I'm really going to be focusing on the ResurFX today, but also I'll switch over to the IPL for a second too. So this is the actual ResurFX tip. If you take a look at it, it's very light, which I think is always a concern when you're treating larger areas. I sometimes will switch. There's a foot pedal you can use instead of the trigger action. And I find that I'm doing larger cases. Sometimes it's nice to have the versatility of that. There's a cool tip, so that's something I always check when I'm about to treat a patient, and that really makes things comfortable. Honestly, I tell patients that the treatment itself feels a little bit sort of like sparklers hitting the skin, but really with topical anesthetic, most areas they don't feel it at all. So that really handles that. There's a trigger point there. Looking at the screen, just like all of the M22 technology, I think it's really nicely laid out and it's easy to move from treatment area to treatment area. I really utilize most of the time the square, but there's all sorts of shapes that you can actually use on this dial. So it presets to a circle, but you can switch through, and there's squares and there's rectangles, there's lines, there's different shapes that you can use depending on the area of treatment. So you can really become precise and get into all sorts of nooks and crannies. I usually use the largest spot treatment size unless I'm really fine-tuning some areas and finessing, and I preset it to some pretty common treatment levels. This is really intended for sort of moderate photo damage and moderate resurfacing, so this is a frequent treatment setting that I'll use. And a nice feature is there's a repeat mode on this as well, so I usually hang around 1 second during that time. If you're wondering about where I should start a patient, I think a really nice feature is actually going to the little stethoscope, which is all the presets. And this very accurately, I think more so than other systems I've seen, you can select skin type, you're using it for skin resurfacing, and then pick severity, mild, moderate, or severe. And so in this case, I'll say the patient has a moderate setting. And you can see those were my presets, 35 millijoules, and the density set at 350, and you press OK. Another feature that I really like between this is I would say in about 80% of my patients, I actually use the IPL just prior to doing the ResurFX, and in those cases it's really quick to switch through, so I'm actually able to go back into my system log, and it takes less than about a minute to switch from the IPL to the ResurFX technology. And the IPL handpiece, this really is my daily use piece, and I always check it's got that nice preset sapphire cool tip, which keeps skin safe during treatment and also helps with patient comfort during that time. There's many interchangeable filters. They're really easy to change through this device. Changing out the tip, so most of the time when I'm doing a full face, I use the larger treatment tip, but I can switch this out to a smaller tip if I'm getting around the nose or treating some telangiectasias around the cheeks. And really, that's kind of the ins and outs of the M22. Honestly, yesterday and today, we probably treated 25 patients with the device, so it truly is my number one generator in terms of frequency of procedures that I'm doing, and then just continual, consistent, outstanding results for patients.
So when I think about purchasing a new device, I think about the return on investment and how quickly I'm actually going to be able to pay for the device. And I was happy to know that with a little bit of internal marketing that cost us nothing, we actually paid for the device in 2 months, which I think is unbelievable. Usually I give myself the benchmark of 6 to 9 months. And it really has become one of the most popular procedures I perform in my clinic.